Hello and welcome to Health Professional Radio. Thank you so much for joining us today. I'm your host, Neal Howard. Our guest in studio is Dr. Michael Greger. He is a founding member and fellow of the American College of Lifestyle Medicine. Dr. Greger is also a New York Times best-selling author and an internationally recognized speaker on nutrition, food safety, public health issues, and more. He's lectured at the Conference on World Affairs and testified before Congress. Currently, he's serving as the Director of Public Health and Animal Agriculture at the Humane Society of the United States. And he's in studio with us today to talk about some of the latest trends in nutritional research. Good afternoon and welcome to Health Professional Radio, Dr. Greger.
So excited to be here.
Thank you. You're the author of How Not to Die. It's an intriguing title, and your book covers the top causes of death in America and explains to us how we can treat and reverse some of these maladies. How can we do that?
We can do it overwhelmingly with our dietary choices that we make 3 times a day. Although there are other important lifestyle changes such as smoking cessation and exercise. The most powerful determinant of our health and longevity is our diet. So number one, exposure to the external environment. So the Global Burden of Disease Study, for example, funded by the Bill and Melinda Gates Foundation, the largest study of risk factors in the world, found that the number one killer in the country is our diet, as well as the leading cause of disability, playing a role in things like arthritis and back pain and things one would not typically think have to do with diet. But when people switch their diet, they can have remarkable benefits throughout their life. And so it's just it's an exciting field of medicine to be a part of.
You know, when we're watching television and seeing certain ads, you know, in the papers and magazines and whatnot, it seems that, you know, these top killers are our diabetes, our coronary disease, things of that nature that are killing us, you know, day to day to day to day. It seems that these are things that can only be treated with drugs. Does your book, How Not to Die, promote an integrative approach or a total lack or not use of any medications and simply treating what's wrong with us through nutrition?
Well, the vast majority of premature death and disability is preventable, treatable with nutritional approaches. So about 80% of chronic disease, that 80% of kind of primary care interactions with patients has to do with lifestyle diseases. And for those, you know, the cause is not drug deficiencies. The cause is their lifestyle. If you change the lifestyle, treat the actual cause of the disease, then you can slow down, stop, or reverse these diseases. Now, until that happens, you have to keep people on their medications, but it's important to wean people off their medications. And in fact, that's one of the, I mean, there's a danger in the power of nutritional approaches for patients or doctors that don't know what, how effective it can be, in that if people are on blood pressure medications or on blood sugar lowering medications and all of a sudden they start eating healthier, then people underestimate how powerful these interventions are, such that within a few days you may not need high blood pressure medications anymore. And if you have normal blood pressure, because you just treated the cause of your blood pressure, if you have normal blood pressure, you can't be on blood pressure medications with normal blood pressure.
Yeah.
You drop your blood pressure too low, you'll get dizzy, you'll fall over, you might hurt yourself. Same thing with blood sugars. You can't be taking insulin injections if you don't need insulin anymore. In fact, that's what these studies show. So there's a famous study, this is published back in the 70s, put people on a plant-based diet. In fact, plant-based diet controlled for weight loss. So they forced people to eat so much healthy food they wouldn't lose any weight, just to make sure that the changes were due to the diet specifically and not to weight loss more generally. So they restricted meat, eggs, dairy, and processed junk food, and within 16 days, insulin. So these are all insulin-dependent type 2 diabetics. Within 16 days, there was a 60% drop in insulin needs. Half of the people ended off all their insulin altogether. So we're talking people who have had diabetes for 20 years off of all insulin in 13 days.
Wow.
So, 32 units of insulin on the control diet, 18 days later on none. Right? So lower blood sugars on 32 units, less insulin. That's the power of plants. But it's so rapid, it's so powerful that's why people, if you're on these kind of medications, you cannot do it on your own. You need to go to your physician. You need to work with them so they can slowly wean you off these medications until you don't need them anymore.
Now, are there certain foods that you recommend in your book that act like certain medications, or are we talking just a blanket improvement of your nutritional intake?
Oh, so there are specific foods. So it's beyond just eating a whole food plant-based diet, meaning a diet that minimizes the intake of meat, eggs, dairy, and junk, and maximizes the intake of fruits, vegetables, legumes, beans, split peas, chickpeas, and lentils, whole grains, nuts and seeds, mushrooms, herbs, and spices. Basically, real food that grows out of the ground. Those are the healthiest choices, but there are specific plant foods that have particular benefits. So, for example, I have this daily dozen of all list of all the things I encourage people to fit into their daily routine. One of them is a tablespoon of ground flax seeds. We have these randomized, double-blind, placebo-controlled trials showing that the consumption of just a few spoonfuls of ground flax seeds a day can bring down blood pressures 2 to 3 times better than our leading blood pressure medications and only have good side effects, reducing our risk of breast and prostate cancer, controlling cholesterol, triglycerides, and blood sugars, reducing inflammation, curing constipation. So that's the beauty of these nutritional approaches. All the side effects are good and sometimes can work more powerfully than the leading drugs.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, and we've been in studio talking this afternoon with Dr. Michael Greger, founding member and fellow of the American College of Lifestyle Medicine, currently serving as Director of Public Health and Animal Agriculture at the Humane Society of the United States. He's also an author, his latest work being How Not to Die. It became an instant New York Times bestseller, and we've been in studio talking about some of the latest trends in nutrition research and how a healthy plant-based lifestyle can not only treat but actually reverse some of the top 15 causes of death in the United States. It's been an absolute pleasure having you in studio with us today, Dr. Greger.
So excited to be here. Looking forward to coming back.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. And you can subscribe to this podcast on iTunes.